video. Because the fourth hygiene mistake is one most people never talk about yet, it quietly affects millions of older adults every single day. You will also learn gentle, effective ways to protect yourself starting tonight. And if you care about staying healthy as you age, make sure to like, subscribe, and share this video. Your skin is not just a surface, it is your body's first line of defense. But after 60, that defense gets thinner, drier, and far more fragile than most people realize. As we age, the skin changes. What once was supple and quick to heal becomes thinner, more delicate, and much more vulnerable to irritation, dryness, and infection. The outermost layer of your skin, the one responsible for keeping harmful bacteria out and moisture in, begins to lose its natural oils and elasticity. And unfortunately, many people unknowingly make this worse with one common mistake: using harsh soaps and cleansers. For years, the marketing around personal care products has taught us that stronger is better. Kills 99.9% of bacteria, deep clean, refreshing scrub. These phrases may sound good, but for someone over 60, they often do more harm than good. Strong soaps and body washes that contain alcohol, sulfates, and synthetic fragrances can strip away the body's natural protective oils. This can cause micro cracks in the skin, leading to what doctors call transepidermal water loss. In simpler terms, your skin loses its ability to hold moisture, and that opens the door to redness, flaking, irritation, and eventually infection. Let me share a story. Martha, a 68-year-old retired teacher, was always careful about staying clean. She loved that fresh, squeaky clean feeling after using a strong antibacterial bar soap. She had used the same kind for decades, but last winter, she noticed her legs started to itch constantly. Her arms had dry patches that no lotion seemed to fix. One day, she developed a sore on her ankle that simply would not heal. After weeks of discomfort, she went to the doctor and the diagnosis shocked her. A bacterial skin infection had developed in a cracked patch of dry skin. Her immune system, now slower to respond than it used to be, could not keep the infection at bay. The culprit? Her soap. Her dermatologist explained that after 60, your skin's natural moisture barrier becomes thinner. Soaps with alcohol and strong detergents strip the skin, leaving behind invisible tears that bacteria love to invade. In Martha's case, what began as a little itch led to weeks of antibiotics and wound care. The truth is, many older adults are unknowingly causing damage every single day simply by washing with the wrong products. And the consequences are more serious than most people think. Seniors with damaged skin are more likely to develop bacterial or fungal infections. And in some cases, these infections can even become systemic, meaning they spread beyond the skin into the bloodstream. For someone whose immune system is already compromised, that can be life-threatening. But there is good news. The fix is gentle and simple. Start by switching to a fragrance-free, pH-balanced cleanser. Look for ingredients like ceramides, glycerin, and colloidal oat maltese help rebuild the skin barrier rather than strip it. Avoid anything labeled antibacterial unless prescribed by a doctor, and skip the loofahs, scrubbing mitts, or rough washcloths. Your skin does not need to be scrubbed, it needs to be supported. After cleansing, pat the skin dry with a soft towel, never rubbed. Immediately apply a nourishing moisturizer while your skin is still slightly damp. This helps lock in hydration and rebuild that natural barrier. Thicker creams are better than lotions for aging skin. And if you find that your arms, legs, or back are particularly dry, consider moisturizing twice a day. Another simple but powerful tip: take shorter showers with lukewarm, not hot water. Long, steamy showers may feel relaxing, but they sap moisture from your skin at a rapid pace. If you notice your skin feeling tight or itchy after a shower, it is a sign your natural barrier has been compromised. Martha followed these simple changes: gentler soap, shorter showers, thicker moisturizer, and within 2 weeks, her skin started to feel better. Within a month, the dry patches were gone, and her confidence returned. No more scratching, no more embarrassment, just comfort. So ask yourself, is your soap helping you or hurting you? This small change may seem insignificant, but after 60, your skin is your armor. When it is healthy, it protects you from everything the outside world throws: your way germs, allergens, even falls. When it is damaged, that armor cracks and the risks become real. You have earned the right to feel comfortable in your own skin. And it starts with treating it with the kindness it needs now, not the way you treated it 30 years ago. Now that we have covered your skin, let us turn to another vital part of your hygiene routine that many people overlook, yet it can quietly affect your heart, lungs, and even your lifespan. Let us move into point 2, improper denture hygiene or skipping oral care. Your mouth is a gateway not just to your stomach, but to your heart, your lungs, and your brain. And after 60, how you care for it becomes far more important than most people realize. When most people think of hygiene, they think of washing their hands or bathing regularly. But there is one area that is often left out of the conversation, especially after retirement: the mouth. For many adults over 60, oral hygiene becomes more complicated. Gums may recede, saliva production slows down, and for those with dentures, the daily care required becomes even more critical. But here is the problem. Too many people either assume they can skip brushing on occasion, or they believe that because they no longer have natural teeth, oral hygiene does not matter anymore. That could not be further from the truth. Let us start with what really happens when oral care is neglected, even just a little. The mouth is filled with bacteria, some helpful, others harmful. When teeth, gums, or dentures are not cleaned properly, these bacteria multiply and form plaque. Plaque hardens into tartar, which irritates the gums and creates small openings for bacteria to enter the bloodstream. Once inside the body, those bacteria do not just stay in the mouth. They travel. And where do they go? Your lungs, your heart, your brain. There is a growing body of evidence linking poor oral hygiene to serious conditions in older adults, including pneumonia, endocarditis, an infection of the heart's inner lining, stroke, and even Alzheimer's disease. In fact, some doctors now consider oral infections a hidden trigger for sudden hospitalizations in seniors. Let me introduce you to Harold. Harold is 72. He had been wearing dentures for over a decade and always believed he was doing enough. He brushed them occasionally, soaked them when he remembered, and figured that was plenty. But over the past year, he had begun experiencing more colds, a stubborn cough, and chest discomfort. He thought it was allergies, maybe just aging. But then came the diagnosis: aspiration pneumonia. The cause? Bacteria buildup beneath his dentures had been slowly dripping into his lungs at night. And because he was not cleaning them thoroughly or giving his mouth time to breathe without them, his body never got a break from the constant exposure to pathogens. He was stunned. The dentist who examined him found a layer of hardened plaque on his dentures and inflammation in the soft tissue of his gums. Harold had no idea that something so small, so quiet, could lead to something so dangerous. He is not alone. Nearly 2/3 of seniors who wear full or partial dentures do not clean them properly. Some forget, others never learned how. And a surprising number still sleep with their dentures in every night, which greatly increases the risk of bacterial growth, fungal infections, and irritation that can lead to ulcers or worse. So what can you do? Let us start with the basics. If you wear dentures, take them out every night. This gives your gums a chance to rest and reduces moisture buildup, a breeding ground for bacteria. Clean your dentures with a denture-specific cleanser, never regular toothpaste, which is too abrasive, and a soft bristled brush. Rinse thoroughly before putting them back in. If you still have your natural teeth, brush them twice daily with a fluoride toothpaste and floss at least once a day. Consider using an antiseptic or fluoride mouthwash, especially if your gums bleed easily or feel tender. These are signs of inflammation, and early inflammation, left untreated, is how gum disease begins. Another important tip: do not skip your dental checkups. Even if you no longer have teeth, you should still see your dentist at least once a year. They will check your gums, look for oral cancers, inspect denture fit, and help catch signs of infection before they become serious. Dry mouth is another common issue in older adults, especially if you take medications like antihistamines, antidepressants, or blood pressure drugs. Saliva helps neutralize acids and wash away food particles. Without it, bacteria thrive. If you notice your mouth feels sticky or dry throughout the day, talk to your doctor or dentist. You may benefit from an artificial saliva rinse or chewing sugar-free gum to stimulate natural saliva flow. Now let us return to Harold. After his pneumonia scare, he completely changed his routine. He invested in a proper denture cleaner, began removing them at night, and started brushing his gums and tongue gently each morning. At his next checkup, his dentist saw significant improvement, and Harold himself felt better. No more cough, no more fatigue, just a renewed sense of energy and safety. So ask yourself honestly, when was the last time you gave your mouth the same level of care you give the rest of your body? Because when your mouth is healthy, your whole body benefits. From preventing lung infections to reducing heart risks, this one small habit has a ripple effect that touches everything else. And now that we have talked about your mouth, let us look a little further down at a part of the body we depend on every single day but rarely think about in terms of hygiene, our feet and nails. You might be surprised how much neglecting them can affect your entire body. Let us move into point 3, ignoring nail and foot hygiene. Your feet carry you through life, but after 60, they carry more risk than you may realize. Neglecting their care can lead to infections, pain, and even hospital stays. When people think of hygiene, they often focus on their face, hands, or teeth. But what about their feet? For seniors, this is one of the most commonly overlooked areas of hygiene, yet it is also one of the most important. After 60, your feet go through quiet but significant changes. Circulation slows, the skin becomes thinner and more fragile. Toenails grow more slowly but also become thicker and harder to manage. Your sense of balance and sensation may diminish slightly, making it easier to miss injuries or irritation. All of this means one thing: your feet are more vulnerable than ever before. And yet, many older adults unknowingly skip essential foot care steps, sometimes for days or weeks at a time. Why? It could be limited flexibility, difficulty bending over, or simply the belief that if their feet are not hurting, they are fine. But ignoring nail and foot hygiene can quietly lead to serious consequences. Let me introduce you to Edith. Edith is 75. She always prided herself on her independence. She still cooked her own meals, walked to the corner store, and even tended to her garden. But one day, she noticed her big toe was sore. She thought maybe she had stubbed it. A few days later, it turned red and began to swell. She assumed it would pass, but then came the fever, the sharp pain, and finally the emergency room visit. The verdict: a toenail fungus that had turned into a serious bacterial infection, cellulitis, which had spread up her leg. The doctors told her that because she had ignored the early signs and had not inspected her feet regularly, what might have been solved with an antifungal cream now required IV antibiotics and a week-long stay in the hospital. All from a toenail. This is not rare. In fact, fungal nail infections affect up to 50% of people over 70. Many go unnoticed for months. A yellowed nail, a thickened surface, a small bit of discomfort in a shoe. But left untreated, these infections create entry points for bacteria, and for seniors, that can mean serious complications. Your feet are also where ulcers, pressure sores, and circulation problems often begin, especially for those with diabetes. And because these problems progress slowly and often without pain, they are easy to overlook until it is too late. So what can you do? It starts with daily inspection. Every morning or evening, check the soles of your feet, between your toes and around your nails. Look for any redness, swelling, peeling skin, discoloration, or signs of fungus. If you cannot see the bottom of your feet easily, use a mirror or ask a loved one or caregiver for help. Next, keep your feet clean and dry. Wash them daily with warm water and a gentle, fragrance-free soap. Be sure to dry thoroughly, especially between the toes. Moisture trapped in these areas is a breeding ground for fungus and bacteria. Moisturizing is also essential. Aging feet tend to become dry and cracked. Use a rich, unscented cream on the tops and bottoms of your feet, but never between your toes, as excess moisture there can encourage fungal growth. When it comes to nails, keep them trimmed straight across. Avoid cutting too close to the skin or rounding the corners, which can lead to painful ingrown toenails. If you struggle to trim your nails due to poor vision or grip strength, consider seeing a podiatrist regularly. Many insurance plans cover foot care for seniors, especially those with diabetes. And do not underestimate the importance of your footwear. Shoes should be supportive, breathable, and fitted correctly, not too tight, not too loose. Avoid walking barefoot, even at home, to protect your feet from injury. Let us return to Edith for a moment. After her hospital stay, she became more intentional about her foot care. She scheduled quarterly visits with a foot care nurse, switched to breathable cotton socks, and even kept a small foot mirror near her bed so she could check her feet without strain. Her infection never returned, and her confidence in her mobility grew stronger than ever. Because here is the truth. Healthy feet do more than prevent infection. They allow you to move freely, to walk safely, to maintain independence. And when your nails are cared for, you reduce the risk of painful pressure, skin damage, and hidden bacterial threats. So if your feet have not gotten much attention lately, consider this your gentle reminder: they deserve it. Every step you take relies on them. Now that we have addressed your feet, let us shift our attention to one of the most delicate and often misunderstood areas of hygiene: intimate areas. What you clean and how you clean, it can quietly influence your comfort, your dignity, and even your risk of serious infection. Let us move into point 4, skipping intimate area care or over-cleansing it. After 60, your intimate hygiene routine should not be an afterthought, but it also should not be too aggressive. In fact, both neglect and over-cleansing can silently increase your risk of infections, irritation, and discomfort. There is a quiet area of hygiene many people do not like to talk about, yet it is one of the most important when it comes to staying healthy, comfortable, and confident in your later years. We are talking about intimate hygiene. For women and men alike, the way you care for the genital area changes after 60. Hormonal shifts, reduced collagen, thinning skin, and decreased moisture all make this part of the body more sensitive than it used to be. And the problem is twofold. Some people stop cleaning this area thoroughly, while others go in the opposite direction, washing it with products that disrupt the body's natural balance. Let us start with the first issue under cleaning. As mobility becomes more limited and flexibility decreases, some seniors find it more difficult to clean themselves properly. Others simply avoid it due to embarrassment, fatigue, or forgetfulness. But neglecting daily cleansing in this area can lead to a buildup of sweat, bacteria, and residual waste, increasing the risk of urinary tract infections, UTIs, yeast infections, and skin irritation. Now, the second issue over cleansing is just as harmful. Many older adults have been conditioned to believe that if something smells a little off, it must be dirty, so they scrub harder. They use scented soaps, powders, sprays, and wipes designed to mask odor. Unfortunately, these products often contain alcohols, synthetic fragrances, and preservatives that strip away the protective layer of good bacteria and natural moisture in the intimate region. Once that protective barrier is gone, the body becomes more vulnerable to infections. Let me share the story of Carl. Carl is 70 years old and always believed in keeping fresh. He used a heavily perfumed body wash and wiped himself daily with antibacterial wipes, especially after using the restroom. Over time, he began experiencing burning during urination and constant itching. His doctor initially treated it as a urinary tract infection, but when the symptoms returned weeks later, they ran further tests. The real cause? Chemical irritation and microabrasions from the wipes and strong soaps he was using daily. Carl's story is common. The skin in the intimate area is far thinner than other parts of the body and far more permeable. That means even mild chemicals can lead to irritation, inflammation, and disrupted pH balance. And for women, especially those post-menopause, decreased estrogen can lead to dryness and vaginal atrophy, making the tissue even more sensitive to chemicals and friction. So what is the solution? First, remember this rule: less is more. The intimate area should be washed once a day with warm water and a very mild, fragrance-free cleanser. Look for products specifically labeled for sensitive skin or recommended by gynecologists or urologists. And avoid douching, powders, or any product that claims to neutralize odor. These products often do more harm than good. Men should clean under the foreskin, if uncircumcised, around the scrotum, and between skin folds gently but thoroughly. Women should wash only the outer genital area, the vulva, not internally. The vagina is self-cleaning, and introducing cleansers into it disrupts its natural bacteria. After cleaning, pat the area dry gently with a soft towel. Avoid rubbing and wear breathable, moisture-wicking undergarments, preferably cotton. Avoid tight synthetic underwear, which traps heat and moisture, creating the perfect environment for yeast and bacteria to thrive. It is also important to urinate shortly after sexual activity, even if it is infrequent. This helps flush out bacteria that may have been introduced to the urethra. For those with limited mobility or incontinence, keeping the area clean and dry becomes even more crucial. If using pads or adult briefs, change them frequently, cleanse gently after each change, and apply a protective barrier cream if the skin appears red or irritated. Let us return to Carl for a moment. After learning how sensitive the skin really was, he made a few simple changes. He swapped his wipes for warm water and a mild cleanser. He tossed the powders and colognes. Within 2 weeks, the itching and burning were gone. He was more comfortable, more confident, and most importantly, he felt like himself again. Because here is the truth. This part of your body deserves the same thoughtful care as any other. It is not about perfection or elaborate rituals. It is about balance. When your intimate area is clean but not stripped, you reduce your risk of infection, maintain your dignity, and avoid the discomfort that so many quietly suffer through. So ask yourself, are your habits helping this delicate area stay healthy or quietly making things worse? Now that we have explored the impact of hygiene on the most personal parts of your body, let us zoom out and take a moment to reflect on what we have learned. Each of these small habits holds the power to change how you age, how you feel, and how protected your body truly is. Let us move into our final reflection, a short but powerful reminder of how these little changes can help you thrive in the years ahead. Aging does not have to mean discomfort, vulnerability, or losing control of your well-being. Often, it is the smallest daily habits that hold the greatest power, like the soap you use, how you clean your mouth, care for your feet, or protect your most delicate skin. These are not just routines, they are acts of self-respect. When you care for your body with intention and kindness, it responds. It protects you, energizes you, and helps you age with dignity. So take a moment today. Make one small change. Your future self will thank you for it with strength, with comfort, and with a smile. If you found this video helpful, please give it a like, subscribe, and share it with someone who needs this reminder. Which of these 4 hygiene mistakes surprised you the most? Let us know in the comments. We read every single one. Your story could help someone else. And remember, it is never too late to take better care of yourself. Start today.